Native hair is breaking or falling out 4 months post-hair transplant. Do I need Rogaine? 38-year-old female, no prior hair loss. Hairline transplant 4 months ago. At my widow's peak, where there was existing hair, there is now a bunch of short hair. I can't tell if my native hair there fell out and this is regrowth, or if native hair has broken off. Now there is a bald spot and my hair isn't as full. Doctor's assistant advised, over email, Rogaine. I was never previously told this would be part of a routine treatment plan, and I am opposed to using it. Shouldn't my hair grow in without Rogaine?
Thank you for your question. You submitted 2 photos, one preoperative and one at the point where you're at. You state you're 38 years old and you had a hair transplant done 4 months prior in the widow's peak area. You're expressing concern about existing hairs breaking or shedding, resulting in what you feel is a bald spot. You contacted your doctor and you were advised by staff that to use Rogaine. You further describe in your question that you were never told about Rogaine as being part of the routine post-operative procedure, and you're asking if your hair would still grow back without Rogaine. Well, I can certainly share with you this type of issue, which does occur fairly often when it comes to hair transplant, and I think there is an opportunity to at least go over some basic principles and how I apply them in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I'm also the founder of TrichoStem Hair Regeneration Centers. This is a system we developed over several years based on a non-surgical hair restoration concept that we discovered during hair transplant, and it's to help people with male and female pattern hair loss. I've been in practice in New York and Long Island for over 20 years, and hair transplant has also been a significant part of my practice. That being said, I think it's part of essentially routine preoperative counseling that there is something that occurs often with hair transplant with native hairs as well as transplanted hairs. And that term basically covers everything. It's called shock loss. And shock loss is a temporary shedding of hair which goes into what's called an early telogen phase. There are 3 phases of hair growth. There's anagen, catagen, telogen. Anagen is the active growing phase, telogen is the resting phase. When you have a procedure like hair transplant, it is fairly traumatic to the scalp, and multiple placements of hair require multiple incisions, whether it's with a needle or with a blade. When that occurs, my interpretation is there's a lot of inflammation, there's a lot of vascular compromise, and existing hair can go into a temporary shedding phase. So it's not unusual for someone to look worse before they look better. Now, looking at your photo, it appears that you were doing this basically to fill what you perceive as a gap in the widow's peak area. It doesn't appear that you have female pattern hair loss. So I think that it is likely that your hair, not being in a thinning process, will naturally grow in a timely way. In our practice, speaking of what we do to help people after hair transplant, we developed this treatment, hair regeneration, which evolved out of hair transplant, where we noticed when using this material called acellular matrix and platelet-rich plasma that thinning hair became thicker after transplantation, and further, the hair grafts actually grew in faster. It's actually now fairly often that we see patients who have had hair transplant done elsewhere who will come in within the first 3 months to have our injection to expedite the healing process, and further, it seems to expedite the regrowth. Now, that being said, I think that the spirit of what the medical staff at your doctor's office wanted to assist you with was the use of minoxidil to try to see if it could expedite regrowth. Minoxidil is a pharmaceutical. It's applied topically and is generally well tolerated, and if it may have some potential value in helping stimulate the regrowth. The answer to your last part of your question, will your hair grow back without the minoxidil? As long as the hair is intact, whether the hair follicles that are native or the hair follicles from the grafts, the answer is yes, they will grow back. There is something called collateral loss which can occur, and it's not intended to further increase your anxiety, but there is trauma that occurs to existing hairs in situations where there's a certain amount of density that results in some what was often referred to as collateral loss. But it's too early to draw that conclusion. Generally speaking, the full expression of the complete healing of a hair transplant and the growth of hair, native and transplanted hair, takes about a year to even 18 months. There are some people who are slow growers and it does take that long, but generally speaking it is a standard in our field to say at about 12 months that you will have the regrowth. A lot of patients will use a topical fiber to help blend that area. This may or may not be useful to you, but it is something that can be used to help people transition through this challenging period when there is often less hair than when you started. Again, going back to this concept of hair regeneration and what it's able to do, we are essentially always trying to help our patients, whether it's with transplant or with progressive hair loss, reactivate resting hairs. And so your doctor may essentially be trying to, again, help you with Rogaine. There can be potentially a value with PRP, but that's also something that is up to your physician and your physician's experience. I would say that it is probable that if you allow yourself to see through this process until the 12-month point, you can at least allow for all of the growth cycles to become back in alignment so that your growth of your transplanted hair and your existing hair will combine to improve what you had preoperatively. So I hope that was helpful. I wish you the best of luck. Thank you for your question.